Raquel, thank you so much for coming in, sitting down to chat with me. I want to start by asking you, what was the reason that you initially came in? And it was just about a couple of years ago, right?
Yeah, so a couple of years ago, I'm a nurse. I'm a bedside nurse, critical care nurse. And I had been dealing with a lot of severe back pain. Even prior to that, I actually just moved to Concord within that time frame. And I was definitely due for some chiropractic care, but I realized that just nothing was enough for me to have that back pain relief. It was to a point where I was actually walking kind of hunchbacked, and that's when my husband addressed it and said I should definitely start looking into having some form of chiropractic care to get that addressed, because it was really affecting my day-to-day life.
Which is terrible. And you're super young, and we should not be, having that kind of a posture at that point. How long had it been since the previous chiropractic care?
So that was when I had seen you, 2022, I believe. Previous to that, I was seeing chiropractic care in 2020.
Okay.
So there was a huge gap of when I wasn't really actively having any care.
Okay. So you came in, we did an exam. Of course, we got x-rays. We figured out what was going on. I put you on a plan. You were coming in pretty regularly in the beginning.
Yeah.
And about how long did it take to start feeling substantially better?
I would say within the first 2 months, I would say that's when I started feeling my pain very minimal. I would always start my day with really bad back pain, having to have some time to really get adjusted to even getting up and out of my bed. And within I would say the second month of 3 days a week of care and spinal decompression, it really tenfold, it really increased my quality of life.
Yeah, I'm glad that you brought up the decompression, because that was critical for you, right? When we looked at the x-rays, we could see that there was disc space narrowing, and if the disc is not nice and plump, it's degenerating. And you need to be able to not only survive, but function and enjoy life for a long time to come. Your job is demanding, is physically demanding. So we use decompression, where we stretch the spine out and we actually restore the disc, right?
Yep.
So this is phenomenal that you had this kind of great result. It's not uncommon, it's very common for us, but it's amazing when the patient gets to experience it. I always feel that nurses are among my favorite patients. I probably said this to you before. The reason is that you guys live in an environment that is really about drugs and surgery. And people come in, it's so common for us to have nurses who have had chronic headaches for 10 years, 20 years. And until they come in and we see what's happening with their neck and we begin adjusting them, they don't have any concept that they can do anything other than take 6 Tylenols every day just to get through, right? Okay, so you're at work and you have long hours, right? You how many hours a day?
Yeah, I work 12-hour days, and I'm on the bedside, so that's 12 plus days, just 12 plus hours just being on my feet, and that's a consecutive stretch of 3 to 4 days. So
lot of strain. So it's remarkable that not only did we make that much improvement really quite rapidly. Some people might say it took a whole 2 months to get that improvement. But let's just be realistic. How long were you suffering?
I was suffering for years, and even with the plan that we had, you definitely recommended all the the supplements. Had a lot of joint and collagen supplements. I even had the back brace that you recommended, and that really helped alleviate. I would say I wore that the back
support brace.
The back support brace, I would say, for a good solid 6 months at work and off work, and that really helped.
There are so many tools. I don't want you to out yourself on this, but I know I gave you exercises, right?
Yes.
These are really important, because as we make the progress and we improve the positioning and the function of the spine, then we want to strengthen the muscles so we can support that. So how good were you with doing the exercises that I gave you?
Yeah, I would say the neck block that
a little traction device.
Yes, that was pretty good. I used that in the morning and the nighttime. My cat-cows had to do those. I would say you told me to do 10 at first in the morning time, and that increased to 20 a day for that 1 year time frame.
Good.
I occasionally do it if my back's still a little uncomfortable in the mornings, but for the most part it's very minimal right now. And then the orthopedic pillow as well, that really helped with just the neck pain and just the discomfort that I've had. Great.
So it really is kind of we have to hit these conditions with a multifaceted approach, right?
Yeah, for sure.
If all you did was come in and we adjusted you think we'd be having this outcome?
No, absolutely not. And it's on top of what you recommended, it was also my job to make sure that I'm being diligent and ensuring that I'm following this path.
Exactly, the teamwork. So I think one of the things that I or maybe the final point I want to make here is people will often ask if they have decompression for a disc problem, how long will the results last? And granted, we're only like around 2 years now, right?
Yeah.
So, but with your line of work, and it's typically 3 days, 4 days, 5 days at a time that you work? Okay, at the, you said 12 hours a day? That's really strenuous, right? And even with that, and we haven't done any more decompression, you are feeling well, you're not having any recurrence of the original symptoms.
Sure. I would say the spinal decompression, I remember being on the table and it's just such a stress relief, and just the pressure during that moment just had that moment of relief, and over time, gradually that relief maintained. So I definitely felt like that was a huge step, and a necessary step for my back pain, especially for how young I was. I felt like I shouldn't be in this severe back pain.
Agreed. Agreed. Okay, here's what I want to end with. You continue to come in for regularly scheduled adjustments. Why?
Because I don't want to fall back to the old ways of being in chronic back pain. Again, I'm too young to have to deal with that.
Yeah.
And I'm very thankful that my husband's very supportive too, and also comes with me for chiropractic care, just to maintain the fact that like I shouldn't be in any pain for the hard job that I'm currently doing. I should be pain-free. I think that's my main goal. It's like being pain-free and having your care and making sure that that you're always keeping me on that path to make sure that whether I'm increasing in pain or if there's subtle differences, that you're ensuring that, okay, this is what I recommend that you continue on.
Right. We want to make sure that we're always aware of the current condition. If things change, if anything is different with your spine than it was a little bit ago, it's time to do a re-examination. It might be time to get a new x-ray. We have to stay on top of that so that we don't just let time go by and have no concept of how things are progressing, right? Terrific. Thank you so much for spending the time with me. I love having you as a patient. You're great. I love the teamwork. You got great energy. I look forward to a lot more. Thank you.
Thank you now.
All right.